Video is on Down syndrome. Down syndrome is a genetic disorder, typically due to trisomy 21. However, in less than 5% of cases, may be due to translocation 21. Let's overview the clinical features and complications of Down syndrome. Neurological features include developmental delay as well as intellectual delay. Patients with Down syndrome may not meet developmental milestones typically related to language and social milestones. So unlike most kids who may be saying a few words at 1 year of age, patients with Down syndrome may struggle to meet these, as well as social interactions. They may not be smiling at 6 weeks of age or waving and interacting with their parents. Intellectual delay can persist throughout life, so they may find it difficulty in learning as well as difficulty in keeping up in school due to no fault of their own. Facial dysmorphia is also another common sign. They may have slanting eyelids as shown in this picture on the left, as well as a flat nose, low ears, and a small head. There may be ophthalmic or eye signs as shown in the right, where this patient has strabismus, and cataracts are also possible. There are also cardiac, gastrointestinal, and neoplastic manifestations of Down syndrome. Cardiac abnormalities relate to structural abnormalities. A common one is atrial septal defect, where there is a hole between the left and right atrium, causing blood to flow from the left atrium to the right atrium across the pressure gradient, manifesting as acyanotic heart disease. In ventricular septal defect, there's a hole in the ventricle septum, so similarly flow from the left to the right ventricle, manifesting as acyanotic heart disease. Tetralogy of Fallot is a complex heart abnormality and results in cyanotic heart disease. It is composed of a variety of abnormalities such as ventricular septal defect and overarching aorta, and right ventricular hypertrophy secondary to pulmonary valve stenosis. Gastrointestinal causes are also very serious, and these include intestinal atresia, Herx-Sprung's disease, as well as celiac disease. Herx-Sprung's disease is especially suspected if the baby has failed to pass meconium within the first 48 hours, and this is due to an aganglionic or poorly functioning ganglion of the bowel. Celiac disease is more commonly known as gluten intolerance, and there may also be secondary lactose intolerance. A patient with Down syndrome is also at increased risk of cancers, including acute myeloid leukemia, as well as acute lymphoblastic leukemia. Investigations is usually done in the antenatal process, and to understand more about the different tests and details done in antenatal screening, please see our separate video. An overview is that in the first trimester, nuchal translucency or an NRPT can be done to detect Down syndrome, and this is done through assessing the fluid around the baby. A positive result does not guarantee Down syndrome, it just makes it more likely, and these are non-invasive tests. In comparison, an invasive test is a chorionic villus sampling, shown in this diagram, where the chorionic fluid is aspirated and is done with an ultrasound guidance to ensure you're going in the right spot to minimize risk of miscarriage. Second trimester can include invasive tests such as an amniocentesis, shown here, which is again ultrasound guided but detects chromosomal disorders, so it may detect the trisomy 21, and this is different to the first trimester stuff, which measured the fluid around the baby. Management is complex and requires a multi-disciplinary team, as it is a lifelong condition. This involves counseling both for the patient, so they understand the disease, as well as the parents. It's also important to make parents aware of different support groups, whether it be other families with Down syndrome, any social workers, any help with learning given any intellectual delay. Genetic studies can be done testing any parents, any siblings with Down syndrome, but they're likely to have already been picked up prior. It is also important to monitor and manage for complications secondary, for example, to cardiac disease or any gastrointestinal disease or any cancer screening or cancer treatment required. Thank you for watching. I hope you learned something. If you did, please tell a friend who may also find it useful.